Thanks again for having me this morning and the opportunity to speak to you guys. I'm Joey Gerard. I'm a minimally invasive bariatric robotic fellowship trained surgeon in Tallahassee. I'm about 7 years out from fellowship. I've done about 1,600 robotic procedures, and I'm a little bit of a jack of all trades, and then I do a little bit of thoracic, foregut, bariatric, abdominal wall, colorectal, acute care, a little bit of everything over the past few years. I've pretty consistently gotten to about 100 cases a quarter over the past few years consistently. My goal today is to try and provide you a unique perspective on improving your surgical service line as it relates to robotic surgery. Tallahassee Memorial Healthcare is situated in Tallahassee, Florida. It's a 770-bed hospital with 31 operating rooms. Tallahassee itself is the capital of Florida, but it's only about 200,000 people, so it's not a major city. Now, what you'll notice on the map here is that we're situated in a relatively geographically isolated region. And what I mean by that is that there are very few tertiary centers in the region. Most are at least a few hours away. So because of this, we have a bit of a unique identity as serving as a tertiary referral center while at the same time functioning as a community-based hospital. So as a community-based hospital, we have a focus on improving access to care and health equity. We do this with standalone emergency departments, urgent care facilities. We have satellite clinics in our surrounding rural areas with a focus of telemedicine. So we function as both a community regional center as well as a referral tertiary center. So I bet most of you are familiar with the quintuple aim, and we're going to focus on this just a little bit. And this is our North Star. This kind of guides our delivery of care. Now, we spoke a bit on health equity, so moving to better outcomes. So this has been a major focus for us on improving our robotic surgery service line, specifically trying to improve or increase the percentage of minimally invasive surgery performed at TMH. Patients who have better outcomes tend to have a better patient experience, and we try to do all of this at a lower total cost of care. The thing I want to focus on here is the better physician and care team experience. I think this is where you start with growing your program, is the personnel, your team members, having the right people and building the right culture. What we know is that having the right culture and team members, people who want to work with you, who want to stay there, leads to significant improvement in consistency of your team members, reduces cost, improves efficiency, and there's a lot less focus on financial incentives for employee retention. So let's start with TMH specifically as a robotic journey, and this started back in 2014 with a single SI system. There's a very high rate of open surgery. Almost a third of all surgeries were open. Less than 10 surgeons were utilizing predominantly urology and gynecology. Very limited clinical and administrative alignment. There was no real program. I'm hesitant to call this a robotic program at the time because the robot was mainly seen as an expensive toy for certain surgeons who only wanted to use it for their hard cases. There was no significant focus on high volume utilization. Now, just fast forwarding to present day, you can see that we went from 1/3 down to about 7% of all of our procedures are done open. And this is predominantly one or two surgeons who are nearing retirement perform most of the open procedures. How did we get to this point? So again, we now have a 93% minimally invasive surgery rate. We have 6 Da Vinci systems, a significant increase in the number of surgeons and specialties utilizing the robotic platform. And we have 24/7 access with high block time utilization. How do you get there? How do you make that jump? Well, I joined TMH back in 2021, right after COVID. And at the time, admittedly, there was not much change in the culture in 2021 as when they started in 2014. More surgeons were using it. The volumes had certainly increased somewhat, but there was still this stigma of robotic is only for hard cases. It's an expensive toy. We know it's expensive, but we don't really know how much it costs. And there's no real alignment between the clinical team and administrative team for utilization. So how do we get there? Where do I start? Well, I went straight to my OR administrator and said, I want consistency with teams. I want to start a team system. I also want 24/7 access because the robot's only used from 7 a.m. to 3 p.m. I got laughed at, right? So how do we make the next step? Well, me as a surgeon, of course, I'm motivated for my own reasons. I want teams. I want to make my day easier, and I want to be able to use the robot whenever I want, not just at night. I'm fellowship trained. I know the benefits of the robot, and trying to limit that to business hours almost seems unethical once you realize the benefits of the robotic platform. So what I did, I went to our seasoned circulators, our seasoned scrub techs, the ones who got to choose what rooms they wanted to be in, and they all avoided the robot room. So I said, why? Why do you avoid the robot room? Well, the answer was pretty much the same. We stand there, we're bored, we don't really do a whole lot, and the cases take 5, 6, 7 hours. We want to avoid these cases. We don't want to be in these cases. So I said, well, why don't we increase our lower acuity surgery volume? Let's focus on doing easy procedures. Let me show you that a gallbladder can be done in 10 to 15 minutes. An inguinal hernia can be done in 20 to 25 minutes. These can be done quickly. We can do 7, 8 procedures in a single room in a single day, and we did it. And because of that, they wanted to be in the rooms. There was an improvement in culture. There's improvement in interest. They wanted to be in those rooms doing those cases because they were really cool, really fast, and they got to be a part of something new and great and developing. So improving that culture is where I started. And from there, people who are interested, I even went and got custom pullovers for the robotic team. Just really, really increased interest in the robotic program. So once I built the building blocks, I took that to my administrator, the same administrator, and said, okay, we got people who are interested in the robot now. Can we go back to the team system question? Can we go to 24/7 access? We don't want teams, and we can't do 24/7 access. The major hurdle being we don't have enough people consistently trained and competent in robotics to offer this after hours. We just can't do it. And we don't want teams, we want everybody equally trained in the robotic platform. That way we can plug and play. Anybody's available to come in and cover a robotic procedure. That makes a lot of sense on the surface, but when you dial it down, the training they're referring to was the online training modules. There was not a lot of hands-on, there's not a lot of repetition, there's zero consistency and efficiency with that. So call it providence or divine intervention. The very next day after that conversation, I had a colectomy, okay? I walk into the room, the wrong stapler had been opened, and about 12 laparoscopic stapler loads, which are incompatible with the robotic stapler, had been opened. Well, that was all based off of a brand new scrub tech who read the wrong surgeon's card. So I said, let's get a different stapler. Well, they went and opened the laparoscopic stapler to go along with the laparoscopic staple loads. Well, I didn't have a first assist. I didn't have any help. I needed the robotic stapler. So by now, they've opened 3 staplers without actually asking me before they opened anything, and all of these staple loads. Well, that's expensive, right? The very next case, they opened the wrong mesh based off of the wrong surgeon's preference card. Now, based off of that and sort of my baseline passive aggressiveness, I went to my inventory people. I reached out to my reps and I itemized every single thing that was opened, and I sent an email to that administrator and that administrator's boss and their boss and said, can we really afford not to do teams? Okay, it was somewhere around $6,000 of waste within 2 procedures in a single day. Okay, all of that is avoided by having consistency, by having the team members that say, that's not Gerard's card. That's not what he normally does, right? We went to teams immediately, okay? 24/7 access, okay? We've got the culture, we've got the building blocks, we've got the personnel, we've got the people who want to be there, we've got people that are trained. Why can't we do 24/7 access? Well, again, I happened to be on call one night. A patient that was well over 500 pounds had an incarcerated umbilical hernia. Well, I'm thinking this is what the robot is built for, okay? Well, the anesthesiologist, who I have a very, very good relationship with, came to me and said, I'll do whatever you want, but are we really going to fool with the robot in the middle of the night for an emergency? I posted the first emergency robotic hernia in the middle of the night. I said, watch, just watch. He put the patient to sleep. He went to the lounge to go get some coffee. 22 minutes later, I went and sat beside him in the lounge and said, go wake the patient up. I sent that patient home 6 hours later. They did great. That patient otherwise would have got a big open incision, and in a patient with morbid obesity like that, they're going to, by virtue, have a very large wound. They're going to get an ileus. They're going to be in the hospital for several days. We had a 6-hour hospital stay after a 25-minute operation. He was sold, all right? He took that to all of his friends and colleagues and said, the robot's not so bad. This is actually pretty good. So again, literally overnight, we had 24/7 access. So even if for somewhat selfish reasons, I took it upon myself to say, this is what we're going to do. We're going to build this team. We're going to increase interest, improve our culture within our hospital. And we built the building blocks. So next step, administrative alignment. Okay, I could only do so much without my executive team saying, this is making a lot of sense, let's do this. Because there is a cost associated with increasing access and buying new robots, right? So that's when I paired up with Logan. Logan's my current VP of the OR service line, and he and I hit it off. We had conversations that I've never really had with an administrator before. I very quickly learned that all administrators, by virtue, don't hate surgeons. They don't think of creative ways to sabotage us. And by extension, I was able to teach him that surgeons are very simple creatures. Anybody have kids? Right. I've got 4, okay? They like to ask why. They don't like being told no. They don't like being told you can't. They don't like being told you have to, okay? That's us. We don't like those things. We always ask why, and if you explain it, you'll see that we can be reasonable, okay? If you tell us we have to use this new mesh because it's cheaper, well, if you tell me that, well, this is 10 times more than what we're currently using, that might make sense to me. And I say, that makes a lot of sense. Let's do it. I, on the other hand, may tell him, well, that mesh has like 10 different class action lawsuits against us. Maybe let's not do that. So transparency, I have found, is the single greatest virtue with a relationship between a surgeon and an administrator. And because of the partnership we've developed, our robotic program has just exploded. So we went from a single SI system to 2 SI systems. From there, around 2018 and 19, we swapped out the SIs for XIs, added an XI system. 2 years ago, added 2 through the AMP model XI systems, and then this year we just added a DV5 system through the AMP model. So we've started the building blocks. We've got the personnel, the interest, the culture, and administrative alignment now. That's huge. We're starting to grow. We're starting to build. Well, what do we do next? Well, we're having a lot of success. We need a team to tell everybody about their successes, and that's where we pull in the marketing team. So what we've noticed is building a robotic program, the strategies parallel the strategies for marketing. And that starts with identifying the barriers to growth. We're growing, we're doing a good job, how can we do better? So specifically to Tallahassee, there's a lack of brand awareness, and we'll admit it. Not a lot of people outside of that region are familiar with Tallahassee Memorial Hospital, and there's a few competitors in the region that do have more recognizable names. Patient leakage and surgeon recruitment, and this ties into the geography, right? Not a lot of people know about the region, not a lot of people know about the hospital. How can we be, how can we recruit? How can we get new surgeons to become a part of that system? And even though I said that we're relatively geographically isolated, we thought that we must be keeping every single patient in the region, but that's not the case at all. Bariatrics, cancer, hiatal hernia, a lot of my big surgeries that I enjoy doing, those patients travel, and they travel more often than not because of brand, word of mouth, reviews, and brand awareness. Lastly, patient referring physician education. We realize that we need to educate our patients about their pathology, the benefits of minimally invasive surgery, specifically robotic surgery, and what we have to offer at Tallahassee. It's very common. Well, half of our identity is the community hospital, right? And that's the identity that a lot of people saw. This is a community hospital, have a real medical problem, I need to go elsewhere. And we had to intervene with that narrative. Referring physician education, exactly the same thing. You would think physicians within our network knew of our capabilities, but they didn't necessarily. So, aligning with marketing on a Da Vinci program, we've done all the hard work. We're having good outcomes. Patients are really benefiting from the minimally invasive surgery. We're having so many successes, but we have to tell people about those successes. Otherwise, we're not educating anyone but ourselves. We're not spreading the word. So strategy is identifying our business goals and identifying our success stories and having marketing help us with storytelling and opportunities to spread the word on those success stories. We have a multi-pronged approach, and the reason for that goes back to we have to both educate the consumer and the physician, the referring physicians. I think there's a couple of big reasons that someone would leave your system. That's that they don't know about your system, or their preference is elsewhere. So intervening on those two things on the consumer side and physician side was our target. And our key messaging for this is we have the latest technology. We have all the capabilities. These are all the surgeries that we do, and we actually track our data and outcomes now. Specifically for bariatrics as a center of excellence, we have all of our data, right? Well, we can take that data and say, we're as good as anybody in the country at length of stay, readmissions, complication rates, and we advertise that, right? We have the best care, and it's close to home. You don't have to go 3-4 hours away to get the care, the same care. And being able to articulate the benefits of robotic surgery, well, I can talk about it all day long because I love it, right? Well, it's important also for the marketing team and the executive team to be able to articulate those benefits. So where do we start? This is the cornerstone here of marketing, is our website. Now in the digital age, this is where it starts, and this is where most of our marketing campaigns circle back to, is the website. This is the central hub for information for patients, for referring physicians, and any lead that we obtain with our marketing strategies circle back to our website, if not directly to the provider. The DV5 launch, we've been blessed to have a DV5 this year. It's fantastic. We love it. Incredible opportunity to tell everybody about our story, about our hospital, about our program, being the first to market with the greatest and newest technology. Oh, wait, our competitors don't have this. Maybe we can separate ourselves by showing that we do have the latest technology. We're competing here. And just kind of moving from left to right here, social media ads. My partner is much more TikTok friendly than I am, so I had him be recorded rolling my robot in for me, even though I used it first. And on the right, newspaper ads and press releases. I have family members 3-4 hours away in Georgia who are saying, I saw this ad where you spoke about your new robot. Tell me about it. So it was massive, even though it was just a new robot, which, all right, we got a new robot. Great, let's use it. Let's tell everybody about it. And the impact was profound. Going back to the bariatric surgery campaign, this is big. This is one of our biggest campaigns. And we do this every year. Typically, we strategize by launching a campaign at the beginning of the year where New Year's resolutions are most prominent, with our key messaging being the same as any key message with bariatric surgery, which it improves your quality of life, it prolongs your life, it improves comorbidities related to your obesity. We also really, really advertise the things that you don't see on the ads, right? It reduces your chances of getting cancer. It improves your fertility. I brag that I've got the best fertility rates in the panhandle with bariatric surgery, and it's way better than any hormone replacement or supplementation. Bariatric surgery fixes those things. That's the stuff that you talk about. That's the stuff that you brand. That's the stuff that you want to tell the world about that nobody else is talking about. You don't really see it on the Ozempic commercials. You're not going to get cancer if you take Ozempic, right? So that's what we discuss. That's what we have to build. Going back to the education thing, we're educating patients. We also have to educate referring providers. I spoke with one of our local big internal medicine physicians. He was with his nurse practitioner, and he came up to me and said, why in the world would I send you a patient for surgery when I can just write them a prescription? I looked at his nurse practitioner and said, how often do those prescriptions get covered or picked up? She said, never. And he didn't even know, right? He looked at her and was just kind of astounded, right? So educating these people on things that you may consider common sense may not be so common. And they may think that they're doing the right thing and helping their patients, when in fact, they're not getting help at all. So really, really boosting these educational campaigns has paid dividends. All of our local campaign strategies involves real patients. These are our patients. These are patients that I've operated on that have had success stories, and they want to go tell people about it. And I may sound a little bit small town here, but people drive through Tallahassee and see her on the billboard and say, hey, I work with her. I go to church with her. Let me go ask her how she did and how she's doing. It makes it personal, right? So we try to use, for all of our paid media, real patients of ours. Patient education, again, going back to the website, not only is it just a bland read, we've got videos. You can hear me talk about our program, the benefits of our program, what we have to offer. There's additional videos. My partner's made videos now. We tried to make it interactive. But educational content on the website has been huge. Also, patient testimonials. I think this is probably the single most important thing that we do on our website is patient testimonials. Anybody shop on Amazon? Yeah, you look on Amazon and you find a new product. Do you want to hear what the company says about the product, or do you want to read all the reviews, right? Patient testimonials, that's where it's at. So getting your patients who have had good outcomes to tell everybody about their good outcome. That's what it's all about. We are officially in the social media age, as much as I hate it. Social media is often free advertising. This is easy. Pull out your cell phone, take a picture of your new robot, and say, "Good day at work." It leads to thousands of impressions. It's free. It's easy to do. I don't do a very good job of it, but I try. My partner's really good at it. Hospital really helps with this, and what they thought, killing multiple birds with one stone, let's highlight our bariatric program, let's highlight our employees, and they started doing employee spotlights. So this is my bariatric coordinator moving left to right, my physician assistant, and my nurse. You can see they release one a month, several thousand impressions and engagements, 20% engagement rate just for a social media post highlighting these people. Now, why is this helpful? Patients like to know who their team member is going to be. They like to read about them in advance. Half of the patients I see, they're like, "Oh, I read all your Google reviews and looked at you on Facebook." And people are looking at this stuff now before they come and see you. So they like to meet their team before they actually come to the office. The second thing that this does that we don't really mention is employees love this. Employees like to be highlighted. And as much as they say, "Oh, I'm really embarrassed, don't look at my picture," they love it. They love being highlighted. And physicians also, and potential physicians that you're trying to recruit, they want to build their practice. They want to know that their employer is going to market them and highlight them and help them spread the word and build their practice. So this helps with recruiting new physicians as well, just by going online and saying, "Hey, TMH does a great job of telling everybody in their region about you. That's enticing for me to want to work there." Consumer marketing, educational events. So not just the website, we do interactive sessions as well. Quarterly, we'll do a free live webinar. So that's typically either me or my partner and one of our bariatricians will do a combination live webinar. Just over the past year, we've had 100,000 impressions related to this and 60 webinar registrants. Most of the people who actually come or get involved with the registration typically will come in for an appointment. This is a great opportunity for us to speak for a little while, but also open up for 10 to 15 minutes of live Q&A. Patients join, they log in, and they ask questions directly to the surgeon or bariatrician and get live feedback. So multi-pronged approach. We've talked all about the patient. Let's talk a little bit about physician marketing. How do you market the physician or increase awareness for physician? Again, I'm using the word divine intervention a lot tonight, but a lot of these things just kind of fell in my lap. On the bottom left here, you'll see a dinner that I gave. Now, hiatal hernia is my specialty. I love doing them. I'm high volume. I probably do 60, 70 complex paraesophageal hernias a year, and I enjoy doing them. Fellowship trained, I have good outcomes. But does everybody know that? I just assume they did, right? I'm fellowship trained. Well, not a lot of physicians know what an MIS fellowship is, right? They don't know that a paraesophageal hernia can be handled robotically. If your entire stomach's in your chest, I don't really know what that means, but that has to go somewhere else, right? And I didn't realize it, but that was actually the narrative. So, again, divine intervention. I had a patient come to me who was actually the office manager of one of our provider groups. She had a hiatal hernia repair 10 years ago. It came back. She had a complicated revision with permanent mesh, with a mesh erosion, okay? So they have to say, "Well, that sounds complicated. That has to go somewhere else." Well, she didn't want to travel 4 hours. So she heard about me through our campaign. She came to my office and said, "Is this something we could do here?" No problem. I took her to the operating room. We did it robotically. It took me about 2 hours to take out all of our old eroded mesh, repaired her hiatal hernia, took down her fundoplication, and she went home the next day. She did great. I can breathe again. I don't have reflux anymore. I can walk my dog now. She had an incredible outcome. Well, she went back to her office and told everybody there, right? Dr. Gerard did my surgery, even though y'all told me to go to Tampa, and I did great. So 2 or 3 different providers came up to me and said, I had no idea that we could do this here. Can you have that robot company like host a dinner, or somebody host a dinner and tell the partners about this? It was easy. It was so easy. I reached out. We hosted a dinner. 9 physicians and several mid-level providers from that one office came over for a dinner. I just had a quick PowerPoint telling what I do, and then a bunch of cool little videos for them to watch, right? A CT scan of a gastric volvulus, and a live video feed that was unedited of how I reduced the volvulus, fixed the hiatal hernia. You never saw a suction device, and you never saw any blood. 0 blood loss, a 1-hour procedure. Patient went home the next day. I have my length of stay data. It's like 1.2 days even for complex hiatal hernias. I got 25 referrals for hiatal hernia from that one office within 3 months, and every single one of those went to surgery, okay? That's not including an esophageal neoplasm and a lot of bariatric referrals I've got from one office based off of one dinner. It's impactful, okay? Moving to the right, there is no magic pill. This is a bariatric campaign sponsored through Intuitive, and this is their first marketing directly to consumer campaign. And this is only meant to improve awareness and education about the reality of surgery versus GLP-1, because admittedly, Big Pharma, to their credit, they do really, really, really good at advertising their products. We as physicians don't do so well at advertising our products, but the data's there. We don't have to go create it. We don't have to go do research. The data's already there. We already know that surgery outperforms GLP-1s. We know that if you want to reduce your cancer rate by 60%, you have to have at least 30% excess weight loss. GLP-1s don't provide that. Surgery provides that. New data from the ASMBS has shown that the break-even point financially is 7 months. After 7 months, surgery becomes cheaper than a GLP-1. Surgery's once and done for the most part. GLP-1s are meant to be used lifelong. Weight regain after GLP-1 cessation is significant. GLP-1s induce gastroparesis. You get full all the time. How do you think that responds to reflux? Have patients with debilitating reflux, now with Barrett's esophagus, and they're on Ozempic. So education, improving awareness, we have to do a better job of that, and that starts with the physician, honestly. And that's part of the reason I'm up here, is spreading awareness and education. GLP-1s are great. I utilize them on certain patients. This isn't about a competition or choosing one or the other. This is about laying the data out and improving awareness of the truth, the benefits and pros and cons of each pathway. Sorry for the tangent. So intuitive marketing resources. So this kind of goes back to the No Magic Pill campaign. This goes back to the, I tried to build my own website. It's not very good. I tried social media campaigns. I'm not very good at it. Oh, wait, I'm employed and they have a marketing team, right? You don't have to reinvent the wheel. Intuitive has profound amounts of resources, pamphlets that you can put in your waiting room, patient FAQs, social media milestone templates, right? There's a template, plug in your numbers and success stories that you want to advertise. Intuitive's already made it and it's free for you. Utilize it, right? Customizable presentations, they help me out with those, right? We customize a presentation and I provide the data, the meat of what I want to disseminate. Intuitive has a massive amount of resources and I strongly encourage you to use them. They're free. So, quantifying the return on investment of your marketing. ROI, I didn't know what that stood for a few years ago, and now here I'm having a daily conversation about it with my administrators. What is the ROI on all the benefit that we've done so far? Trying to explain a return on investment on a brand new robot to an administrator when I speak a very, very different language than they do can be difficult, and quantifying that return on investment can even be more difficult. Again, let's go back to my example. I had a $2,000 dinner. It seems expensive, but everybody got steaks and at least 2 cocktails, but it was $2,000. Within 3 months, I had 25 referrals. Every one of them went to surgery. And based off the national average contribution margin of a paraesophageal hernia, over a 50x return on investment from a single dinner by a single physician from a single referring practice. How else are we quantifying our return on investment? We want to grow a robotic program. Well, is it just an expensive toy or is there a benefit to it? You can see there's been a 33% volume growth just over the past year, and we're on course this year to break 2,000 robotic procedures. We're growing very, very rapidly. Where's that growth coming from? Well, I do a lot of robotic surgeries, but I don't really have any more room to grow, right? So where's new growth coming from? New surgeons. 50% of our growth from new surgeons. Well, I've been told since I've been there, it's so hard to recruit surgeons to the area. People don't know about Tallahassee. Well, I get on the phone with programs, training programs, friends of friends, and say, hey, we've got 60 robots, we've got a DV5, we've got 24/7 access. I'm doing 400 or 500 robotic surgeries a year. I need help. Surgeons want to come to that, right? I got a brand new bariatric surgery partner. We've got our first colorectal surgery guy within my group now. We've hired acute care surgery service, or hired acute care surgery surgeons, and developed a full service. They all want to be robotic trained because they see the patient that I saw in the middle of the night who has an incarcerated hernia that would best be addressed minimally invasively. You can't do that surgery laparoscopically, and if you do, you're not going to have a long career. All right. The best nidus for me was going through a laparoscopic bariatric fellowship, right? It's a strain. It's a strain on the body to use straight stick laparoscopic instruments for those type procedures. And I have no doubt at all that the robot will prolong my career. That's common knowledge now. New surgeons know that coming out of training. The robot is not even specialty anymore. You don't have to do a fellowship to do robots. People are using this in training, and they want to know that their job has access for them to grow their robotic program. So that's how we get new surgeons here. That's our nidus for continued growth. So key takeaways here. Collaborate and align at all levels. The clinical team has to align and collaborate with the executive team. Otherwise, you go nowhere. And if you're successful with that, you should have better patient outcomes. You should have improved patient experience. You should be able to offer that at a lower total cost of care. But how do you grow? Share your success stories with your marketing team. So that's the third piece of the pie. Build the infrastructure for growth. Again, that starts with the clinical team experience, right? Anybody impacted by COVID? Yeah, everybody, right? Anybody impacted after COVID, trying to get travel nurses to stay at your facility? It was extremely difficult. One of the best scrub techs I've ever worked with was a traveler, made significantly more than our employed surgical techs. And I tried really hard. What can we do to get you to stay here? Well, I'm going to take a significant cut. You don't have to travel anymore. You know who you're working with every day. Team systems, right? Culture, 24/7 access. He knew what cases we're going to do every day. He knows roughly when he's going to leave every day. He signed, right? He took a pay cut and signed at our facility, my scrub tech. This guy I use every single day. So building the culture, people are willing to work for a little less money. They're willing to take a little bit of a haircut to have consistency and work at a job that they enjoy and they're proud of. So build the infrastructure by staff experience. Integrate the marketing team. I've mentioned that already. The DV5, big example. I kind of want to highlight that again. I know Intuitive highlights that I think there's a 17-minute time reduction per case for DV5. My administration didn't buy that. When I mentioned that, no, they didn't buy that. Okay, you're already pretty fast. If you stop answering your phone, you'll be 17 minutes faster. They didn't buy that. Well, how am I going to explain the return on investment to my administrator? We did a total practice observation. I didn't have to speak his language. I didn't get a Rosetta Stone for administrators. We went to a total practice observation where they were able to align their administrator with my administrator, their surgeon with me, their assistants with my assistants, and everyone spoke each other's language. And we came back from the total practice observation, and he was way more excited than I was about getting the new DV5, getting our hernia center of excellence, advertising our successes. He came back because he saw the return on investment spoken in a language that he understands, okay? Differentiate with data. Well, you can't differentiate your program with data unless you know your data, right? Track your data. I've been at facilities where administration is hesitant to be involved in the operating room unless there's a problem to be solved. Well, they're doing okay, so I'm not going to involve myself. Involve yourself. Track your data, know your data, advertise your data, highlight what you do a good job, and tell the world that you do a good job in those areas. And you have to do that by collecting your own data, The MACA team with Intuitive has resources for that, for overlaying their infrastructure on yours to help you track your data. But I can't overstate the importance of that. Patients are educated now. Patients know how to look online at reviews and data. I have patients ask me all the time, what is your hernia recurrence rate? Nobody would have ever asked that 10 years ago, right? What is my anticipated excess weight loss after a gastric bypass? Patients would never have asked that before. Patients are knowledgeable now. They want to know your data. And if you don't know it, they're going to go to someone who knows their data, right? So track your data. That's all I have.